In 2015, the government of Ethiopia made a bold and innovative high-level declaration to end stunting in children under 2 by 2030. This high-level commitment, known as the Sekota Declaration, or SD, operationalized through a multi-sectoral and multi-stakeholder program involving 14 sector ministries. The Sekota Declaration builds on and supports the implementation of the National Food and Nutrition Policy and Strategy. The 15-year roadmap is divided into 3 phases. These are the innovation phase, expansion phase, and scale-up phase. The innovation phase focused on the implementation of priority high-impact intervention packages that demonstrated 3% annual average stunting reduction rate and generated wide range of learning and evidence informing the expansion phase. The expansion phase was started with 240 weredas and is based on the Sekota Declaration roadmap and the proven impact demonstrated in preventing stunting. The government has now approved expansion to additional weredas, making it possible to reach out to a total of 700 vulnerable weredas by 2025. The national scale-up phase, which will extend from 2026 to 2030, involves full-blown implementation of evidence-based multi-sectoral interventions. Addressing the complex challenges of stunting, especially in areas like the Sekota Declaration, requires an innovative approach and concerted efforts of all relevant stakeholders. Understanding the situation, the federal government of Ethiopia, represented by the Ministry of Health, and in collaboration with the Ministries of Agriculture, Water Irrigation and Energy, Education, Women, Children and Social Affairs, with Africa Development Bank, have jointly designed a 4-year nutrition-focused project called the Multi-Sectoral Approach for Stunting Reduction Project, or MASREP. MASREP is designed to contribute to the realization of the Sekota Declaration, or SD, commitment through implementation of a package of nutrition-specific, nutrition-sensitive, and climate and nutrition-smart infrastructure development projects in the 40 SD Innovation Phase weredas of Amhara and Tigray regions.
Indeed, the African Development Bank appreciates and fully supports Ethiopia's bold vision of eradicating the underlying causes of chronic undernutrition and ending stunting among children under 2 years by 2030, as underscored in the Sekota Declaration.
MASREP is a 4-year project financed by Africa Development Bank with a total cost of UA 34.17 million, or 48.17 million USD. The project is being closely coordinated with interventions of other development partners in the project area. The overall objective of the project is to increase access to multi-sectoral nutrition services for children under 5 years in the Sekota Declaration areas, focusing on nutrition-specific, nutrition-sensitive, and infrastructure development interventions. The projects envisage the outcomes of improved access to services for health among children under 5 years and PLWs, increased production and consumption of diverse and nutritious food, and improved knowledge, attitude, and practices on feeding, care, and hygiene. The project has 4 components. These are Component 1, Climate-Proofed Infrastructure Development for Effective Service Delivery. Component 2, Livelihood Support, Production, and Promotion of Nutritious Foods. Component 3, Strengthening Institutional Systems and Capacity Building. Component 4, Project Coordination and Management. Among the 40 target weredas of the SD program, the project implemented the full package of multi-sectoral interventions in the prioritized 17 weredas, that is 9 in Amhara and 8 in Tigray regions, while the remaining 23 weredas benefit from partial package that consists of SBCC and system strengthening activities to complement government's multi-sectoral interventions. 1. Health sector. To improve health services, Health posts have been constructed with packages of water supply, solar power, and sex disaggregated latrines, and have commenced providing quality health and nutrition services to the targeted community. Various capacity building trainings have been provided to health workers, religious leaders, community leaders, and frontline workers in nutrition and SBCC. These initiatives aim to enhance social and behavior change among the target communities, especially fostering the consumption of nutritious and diversified foods. 2. Irrigation sector. To increase the production and consumption of diverse and nutritious foods and enhance access to water supply for agricultural production, small-scale irrigation projects have been constructed. As a result, households have gained access to cultivated diverse and nutritious dense crops, fruits, and vegetables. 3. Agriculture sector. To improve agricultural and household practices and diet diversification, nutrition demonstration corners have been constructed at farmers' training centers, and pregnant and lactating women were equipped with wash and energy-saving stoves. This initiative encourages households to participate in cooking demonstrations and attend nutrition training sessions, promoting the production and consumption of diverse and nutritious foods. To attain this, the project conducted livelihood support, focusing on fisheries, dairy goats and poultry production, and chicken farming targeting pregnant and lactating women, or PLWs. This assistance aims to boost the production and consumption of nutritious foods within households, such as eggs and milk. Additionally, any surplus can be sold to generate household income and savings, providing mothers with opportunities for sustainable economic activities and to utilize the savings to replace the chicken when they no longer provide eggs after 2 years. Various capacity building training sessions have been carried out for farmers, agriculture experts, and women managing backyard gardens of vegetables and fruits. Several community seed multiplication centers have been established, along with the provision of farm tools to support pregnant and lactating women with children less than 2 years. The livelihood provisions are supported with regular technical follow-up from agricultural health extension workers. 4. Water sector. In an effort to improve access to safe and clean water, various water supply projects have been constructed. Numerous households and institutions, including health centers, schools, and various government entities, have benefited from these water supply projects. Capacity building training sessions have been offered to members of the Water Sanitation and Hygiene Committee, or WASHCO, and water user groups, aiming to enhance their knowledge and skills in order to manage the schemes in a sustainable manner. 5. Education sector. To enhance primary education access and service quality, different model nutrition schools aimed at providing students with homegrown school feeding packages are being constructed. Capacity building trainings were conducted for school health and nutrition club members and teachers, as well as mini media clubs. Schools are also furnished with mini media equipment to enhance their communication capabilities. Farm tools and seeds of different vegetables are provided to target schools, and the schools have commenced the implementation of school gardening, cultivating vegetables and fruits, and are witnessing tangible benefits for the students. 6. Women and Social Affairs sector. The project is gender responsive, and the direct beneficiaries of the project are children under 5 years old, pregnant and lactating women, and adolescent girls. Most project interventions are geared towards benefiting women, children, and adolescent girls. Men were also involved during the project activity implementation. During reporting, the project tracks the proportion of women-headed households. Strengthening data revolution. Evidence-informed decision-making in nutrition requires the availability of timely multi-sectoral data in Ethiopia. With the technical and financial support of UNICEF and the contribution from other development partners, the government set up a Unified Nutrition Information System for Ethiopia, or UNIS. And the pilot implementation was done in the Sekota Declaration Innovation Phase Waredas as part of the Data Revolution information of the Sekota Declaration. UNIS is integrated to the National District Health Information System, or DHIS2, to manage and monitor multi-sectoral nutrition data online at all administrative levels. Unified Nutrition Information System for Ethiopia, or UNIS, combines both nutrition-specific, 10 indicators, and nutrition-sensitive indicators, 70 indicators. The UNIS expansion has currently reached 111 SD expansions and SINES Waredas through the provision of computers, establishment of internet connectivity, and provision of training to different sector experts. The Sekota Declaration has evolved into a pivotal focus at both continental and global levels. Its impact is poised to be exemplified and disseminated to other African nations through the endorsement of the Presidential Declaration for the Acceleration of Stunting Reduction in Ethiopia. This initiative aims to showcase and share the experiences garnered, fostering collaborative efforts in addressing stunting reduction on a broader scale across the African continent and beyond.
Investing in nutrition, therefore, builds human capital, creates opportunities to develop a healthy workforce, extends life expectancy, and lifetime productivity. The first 1,000 days of a child's life are extremely crucial to building their brains, what I call gray matter infrastructure. We can repair a road, no big deal. We can redo a rail or port. If it's not working, no big deal. But we cannot repair the brain of a human and the cognitive capacity that's lost once it's lost due to severe malnutrition.
The government of Ethiopia appreciates the exemplar partnership and commitment made by the African Development Bank to finance the Sekota Declaration and is working together to take the lessons learned to the continental level.